Welcome to our podcast, Journey into the Future of Medicine. I'm your host, Bill Maggio, Chief Executive Officer of the Jacobs Institute. We are a nonprofit medical device innovation center here in Buffalo, New York. Here we talk about what is possible in the next quarter century of medicine and healthcare, based on a report we published titled The Future of Medicine.
Due to COVID-19, this episode was recorded through an online platform, which accounts for differences in sound quality. Jean Wactawski-Wende is Dean of the University of Buffalo School of Public Health and Health Professionals. She is a State University of New York SUNY Distinguished Professor and a professor in the Department of Epidemiology and Environmental Health. Dr. Wactawski-Wende is the principal investigator of the Women's Health Initiative, WHI, a landmark long-term national health study that is focused on strategies for preventing heart disease, breast and colorectal cancer, and osteoporotic fractures in post-menopausal women. She has also served as principal investigator on dozens of federally funded research studies and large-scale prevention clinical trials in women. Prior to her role as dean, she served as vice provost for strategic initiatives and research advancement. Dean Wactawski is a graduate from Canisius College before receiving her master's degree and PhD in epidemiology from UB. Dr. Wactawski-Wende, thank you for joining us today.
Thank you for having me.
It's our pleasure. You know, as a nonprofit, the JI hosts these podcasts to serve as a springboard for conversations around health and medicine, which complements, quite frankly, our mission to accelerate the development of technologies to treat primarily vascular disease. Your insights into the larger picture of public health and women's health, as well as how COVID may be impacting them, are very timely topics. So let's go ahead and get started. Can you define, for our listeners, I guess kind of a day in the life, what does the field of public health encompass?
So public health is a discipline that's focused on protecting and improving the health of populations as opposed to individuals. And the field really focuses on prevention and education of the general public, and the intent is to improve health and reduce risks in populations. So we do that by promoting healthy lifestyles like healthy diets, physical activity, reducing non-health behaviors like smoking. But people in public health also do research, clinical trials, as you've mentioned, that are mostly related to assessing preventive activities rather than treatment activities. The work that we do helps us to understand risk of both chronic diseases like heart disease, that vascular disease that you've talked about, and how to prevent them. But we also do work in understanding and preventing infectious diseases like the COVID-19 that we're experiencing now. Public health workers also do things that are kind of in background. They protect safety of our food and our water. They respond to emergencies that occur. And the field of public health is really central to the well-being of all of us. Now, if done well, public health may not even be noticed because it's in background and its workers are keeping our communities healthy. It's during times of emergency outbreak when we understand how important public health is and how important the infrastructure of public is to all of us. So at UB, in our School of Public Health and Health Professions, we have a mission to protect the health of populations and communities, and we do it by educating the next generation of public health workers, and we do it by doing research, and we provide service in the community.
Wonderful. You also have an expertise in epidemiology. Mm-hmm. For our listeners, can you give us, what is epidemiology's 101, just so that there's a baseline of understanding? Because I think it's very applicable given what we're dealing with right now with COVID-19.
Right. So I'm a trained epidemiologist. The field of epidemiology got its name from the term epidemic. So it's kind of studying the determinants of disease, and early on it was mostly infectious disease. So we look at factors that are associated with increase and decrease in diseases. So what things determine who gets a disease, when, how, in which populations. So it's a scientific discipline that looks at public health, as I said, as a group or a community or a population.
Yeah. So you had said, if I'm correct, that one of the things that you do in public health is help to respond to emergencies. Would you classify or characterize the COVID-19 pandemic as an emergency?
Oh gosh, yes. It's probably one of the most important things we've seen happen to community in the United States, and in fact, in this case, worldwide for probably over 100 years. So the public health workforce, includes epidemiologists that are studying the disease. It includes many medical personnel. It includes the people on the forefront, like nurses. All this is part of what we call an infrastructure of health. Now, one of the things that public health officials do, including epidemiologists, is track and trace the disease. When are cases coming? Right. Where are they coming? And who are they coming? And so this has been really pressing the public health infrastructure. I don't think we've seen anything quite like this since the 1918 Spanish flu.
Interesting. So just from your perspective, how is this COVID pandemic influencing today the fields of public health? But how do you see it influencing in the future as well? Because you are right, it has been a transformative challenge for our healthcare system here in the United States. So I'm just curious, how is it going to change public health going forward?
Well, certainly just the notion of what is public health, what is an epidemiologist. A decade ago, probably no one could understand what an epidemiologist was or even pronounce it. And today you see the term epidemiology on the front page of the newspaper on a daily basis. I know at the university, our job is to train the next public health workforce and to do research. And the interest in our discipline is up. We have had the highest number of applications come to our programs this year than ever. And we're responding. We have training in infectious disease and just the whole discipline of public health, but we're adding new classes on pandemics and emergency response. Nationally, we're working to develop competencies for our trainees, what they'll need to be prepared for in the future, because I expect this won't be the only infectious disease we'll see, hopefully not at this level, but it's coming. So I think the whole discipline and understanding is going to change towards the future.
It always fascinates me, this nation, just how people rally, from individuals volunteering to participate in vaccine studies to retired healthcare workers stepping up to the front lines and young people making life career decisions to go into a field in college. It just fascinates me. It's so encouraging to hear this. And I hope that my listeners share the same opinion that I do.
I agree with you, and I know, I just wanted to add that, I know also at our nursing school here at UB that applications are up, and, the fact that people are stepping up to do and engage in careers that have such meaningful importance to us all. I agree with you. It's very encouraging.
Just as an aside, I have young daughters in college. This is just a question I think so many people have. Can a university like UB Is it safe for the kids to go back to school in the fall? I mean, as a leader in the school, and I know you probably can't comment fully on what you're doing, but just what's your perspective as a professional who's directly engaged in our national effort to address this?
Yeah, sure. So the university is very carefully looking at what our plans are going to be for this fall. I and many other of our faculty and staff and even students have been doing planning. We have about 200 people working on one of several committees trying to put together what plans would be, what would, whether we would expect to have fully on campus or fully remote. Ultimately, we're putting together a document for the president and provost to consider. Obviously, the first regulations come from the governor and from the Western New York region on what could be done. But we're looking at this from both a mission standpoint, our educational focus, our research focus, but our first priority is safety and health of our students, of our faculty, of our staff. So we're looking carefully. No decisions have been made yet, but I can tell you it will be a thoughtful process on our part.
Thank you. Thank you for that perspective. There are millions and millions, tens of millions of dollars in federal research funding from the NIH for COVID. What, in your opinion, what are some of the more prominent research efforts in epidemiology that you think are the most interesting or promising?
So we in the field are already doing prevention trials, clinical trials to look at agents. One of my colleagues is doing an assessment of the role of vitamin D in preventing transmission. So we do that type of research. There are opportunities from basic science to translational trials, and I know our university is involved in some of those trials. Personally, some of the work I do is in women's health and the Women's Health Initiative study, and we're in the midst of doing studies of the effects of COVID on older women.
Before you go on with that, can you tell us a little bit about the Women's Health Initiative? Because I'm fascinated by it, by its scope and by what you've been able to accomplish.
Thanks, Bill. This has been primarily my life's work. 1993, the National Institutes of Health recognized that we've been doing a lot of research, but 70% of it was in men, and then some of the results were applied to women. And the decision was made to start a large national trial called the Women's Health Initiative, and we were fortunate. At that time, I was just a new assistant professor to write an application and be chosen as one of 16 Vanguard centers in the United States. Eventually, 40 centers were selected. But WHI enrolled 162,000 postmenopausal women with the goal of looking at primarily hormone therapy, calcium and vitamin D supplementation, and a dietary intervention to see if we could reduce heart disease, cancer, osteoporosis, many other things, including dementia and stroke. So this was a set of trials that then completed. One of the major findings was that hormone therapy had more risks than benefits and changed the face of menopausal therapy across the world. But the study continued, and now we're just starting our 28th year of follow-up in this group, and we're still doing trials within these women. We have a clinical trial of 50,000 of our women who are half in a physical activity intervention, and the average age of this population is now about 84 years of age, to see can we impact health. These women and this is now 28 years later, still respond and join these studies at a high rate. We get a 90% response rate on this research, and it's led to over 2,000 published papers in this cohort and told us so much about women's health and older women's health. Our participants now range from the age of 78 to 103 years old, and we've just learned so much from them.
Are there any studies exploring how COVID impacts this same population of older women?
So with the COVID coming, it was an opportunity to look at these women who we know so much about. And we're looking both scientifically at how often our participants are contracting COVID and what the outcomes are. But we're administering questionnaires to these women to ask about their mental health. You know, is this caused anxiety, stress, strain, sleeplessness? Have they tried interventions that have been mentioned, like vitamin D or other things in the community? We're really concerned, and I think this is starting to come up in public discussion, is the isolation and the fear of going out of the home, that many people are not getting typical screenings, colonoscopies, mammograms, and we'll be able to look at this within our WHI women, what they did before COVID, what they're doing now, and look at the health impacts of distancing, social isolation on women's health. So it's a remarkable opportunity to determine what's happening. And because it includes women from across the United States, we can look at practices in different parts of the country. And we also have a large population that includes almost 20% that are non-white. So we're able to look at differences in the African American, Asian American women in relation to some of the questions we're asking.
It's truly fascinating, because all the things you just talked about are things we hear about all the time on the news, we read about in the paper, the potential, downside impacts of this that we didn't understand or contemplate when this all started. And it must be so incredibly rewarding for you to know that you're going to play, this organization that you're so involved in leading is going to play a significant role when we get on the other side of all this thing, post a vaccine, and when we know that we got it under control. So congratulations to you, and I'm sure our listeners feel the same way.
Thank you so much. But really, the congratulations goes to the participants. These women have been remarkable. For all these years, been doing this and not paid a penny. They get magnets for their refrigerators and things like that. Talking about altruistic people that are doing something to help us all. That's the participants of WHI.
One thing that fascinates me is, what you said. You started, I think, back in 1993. You said typically what they would do is they would take whatever research they saw happening in a male and just try to apply it to a female. How far we've come, because to hear someone like you with your vast set of skills say something like that, it's almost absurd to hear that in today's day and age. So really, my hat's off to you.
Well, things have changed. It took a lot of effort to change the culture of who research was being done on, and we've learned that there are differences by sex, and just our physiologies and how we respond to different things, and so these gender differences that affect how a medication is metabolized, how we respond is really quite important.
I think, as I roll in here to my last couple of questions, I really think the audience, our listeners, would love to get your perspective on how you see this playing out, the COVID pandemic playing out over the next 6 to 12 months. Do you think that there'll be some combination of therapies that will be discovered to work? Do you think there'll be a vaccine in the next 6 to 12 months? I mean, what is your perspective? And we won't hold you to it. Just curious.
As an epidemiologist, I recognize this is it's a virus that's novel, meaning none of us has been exposed to it. So we know that until we can find a treatment or a vaccine, we are all at risk. So some of the preventive things that we've been doing, social distancing, wearing masks, very active hand washing, are kind of principles of public health that work. When you look back to the 1918 flu, actually Buffalo, New York fared fairly well because they put in place exactly these measures. So the more we can do to avoid contact that exposes us to this virus, I think it's going to be important. We really need a vaccine. Vaccines are long and hard to develop, and just watching the number that are in play and how fast they're thinking about doing, phase 1, 2, and 3 trials. These are trials that lead up to understanding in large populations how these work. We won't have that. We've never found a vaccine for HIV. In many cases, it takes years and years to develop, but this has been a worldwide attempt to move this fast. Some of the work being done in the United States, in England, other places. It looks like this vaccine could be ready, I would say, within 12 months. I've heard 6 months. I think that's optimistic, but it's possible. Then we have to get the vaccine into the public, and it's another whole logistical problem, but we're preparing for that. So I'm hopeful by this time next year we'll have some measure to protect us with a vaccine. I'm also really optimistic about trying to find at least some strategies that would reduce mortality. That if we could find some agents or remedies to help us reduce the impact on the people that are diagnosed with it, to avoid the hospitalizations, going on respirators, and unfortunately the number of people that have died from this has been somewhat tragic. So the idea that we could develop some strategies, but for now I think it's the basic principles of distance, hand washing, mask wearing, that is how we're going to get through the next 6 months to a year.
Last question in the minute and a half or so that we have left. How do you think COVID is going to permanently affect social norms and public health going forward? I would like to think that I'm not going to always be afraid to go back into a small restaurant. So what do you think? I mean, what's your perspective on that?
I think as we control the virus, we have treatments, vaccines, it's going to ease all our minds about going into social settings. I miss being able to shake people's hands. I'm a hugger. I miss being able to do that. So I hope there's a time when we'll feel comfortable, but I think it has changed us. We are more aware of just hand washing and, how infectious diseases pass along. Flu exists in our country every year. We have thousands of people die of flu. So being able to think a little more carefully about how we protect ourselves and others by, protecting our faces when we need to cough, doing hand washing. I think those practices are going to stay with us for a while. But it also has provided us at the university, for example, in a 2-week period, we had to go completely distance learning. And so it's advanced our use of some technologies. I think that is not going to go away. People are doing more remote learning and remote business. And so that, I think, is going to become more normal. The other positive thing that's happened, if you look at what's happened to air pollution, is just cleaned up around the world. And so kind of this distancing has had some positive effects in our climate, in our world. So I think we'll see things differently. I hope that we are a kinder, more compassionate world with each other. But I think it will change some of the things that we do and how we do them.
Doctor, a wonderful conversation today. I cannot tell you how much I appreciate you sharing your expertise with us. Thank you so much for joining us.
And Bill, thank you, and thank you for all the work you do in the Jacobs Institute.
Thank you so much for saying so. To our listeners, thank you so much for participating today. Until the next time, good day.
Thank you for joining us on this journey. I hope the podcast served as inspiration to keep pushing the boundaries of what's possible in medicine and healthcare if we simply change our mindsets and practices. Let's bring the future of medicine to our Western New York community. If you enjoyed this podcast, please recommend it to a friend. If you want to help bring the future of medicine to Western New York, please consider donating at jacobsinstitute.org. Thank you for listening.